Hey, it's Dr. Kimberly L. I'm a board-certified OBGYN doctor with nearly 20 years of experience, and today I want to talk to you about something that I commonly experience in our practice, and this has to do with the treatment of abnormal bleeding due to uterine fibroids. So please know that you have to get advice from your own doctor to know exactly what treatment is right for you. But I just wanted to kind of review some of the things that I commonly talk about or I commonly review with my patients just about what is fibroids, okay? So symptoms of uterine fibroids are things such as excessive bleeding, bleeding between your periods, a feeling of fullness in your lower abdomen and tummy. Things like frequent urination, such as if you have fibroids, are actually pushing on your bladder. Painful intercourse, low back pain, constipation, again because they're just laying on your intestines. Inability to completely urinate or empty the bladder. And increased abdominal distension. I'll see this a lot where I have some of my ladies that are, they're very, very slender, but then their belly is protruded. It almost looks like they're pregnant, but they're not. It's just their uterus is there. Okay, so what do fibroids look like? So here's a nice little diagram. The important thing about this is, do know that this is the uterus, tubes, and ovaries are here, okay? But I want you to know that a lot of the symptoms that you feel is going to depend on where the fibroids are located at, and I talk about this all the time with my patients. So if you have a fibroid that's called intramural, which means that it's in the wall of the uterus, or subserosal, which means that it's kind of sticking out from the wall of the uterus, you may not have that many symptoms. You may feel some pressure, but you may not have heavy bleeding. But anything that interferes with the lining here of the uterus can actually give you irregular bleeding. So this is the endometrial lining, and these are the fibroids. This is a pedunculated submucosal fibroid, and this is just a submucosal fibroid because it pushes on the inside. So there's some ladies that can actually have fibroids, but there's not that much bleeding. Those are things where it's kind of like a little combination where it's in the walls, but it's humongous. This is the ones that go really, really big, that push on things. So again, those are things to know about fibroids. There are many ways to treat fibroid. It's going to depend on each individual patient, what they want to do for childbearing in the future, what their symptoms are, how bad, is their fibroids doing for them. Like, are they very anemic? Do they require blood transfusions? I've seen this a lot where they've had multiple hospitalizations because of, just needing a blood transfusion. So eventually, you got to do something about this, okay? So ways to treat it are things such as conservative management. These are the ladies that have fibroids that are actually not very big. You can also use things like hormonal management, like birth control pills. There's also medical management such as a new medicine called Orion, which is an anti-estrogen medicine, or the Defolupron. Those are all based on lowering that estrogen level so that those fibroids can kind of stop responding. Do know that as you get older, for conservative management, your fibroids should shrink anyways. The problem is that if you're only 47 and your fibroids are humongous, they're not going to shrink that much. You're going to still have a lot of symptoms with them. So it's very important for you to then get those taken care of and get them looked at. You can also do things such as uterine artery embolization. This is something that's done by a radiologist where they actually cut off the blood supply. You can also do radiofrequency ablation of the uterine fibroids. And that's where a little probe is stuck into the fibroids. And what happens is that it kind of kills off the blood supply of the fibroids. It's a little bit more invasive. Excuse me. It can be done either through the vagina now, or it's something that actually can be done laparoscopically. But again, it has to be the right type of fibroid. You can also consider doing something like a myomectomy. I actually like doing myomectomies for some strange reason. These are something where, we just kind of open you up, pop out the fibroids, and then stitch everything back up. And this is great because you can keep your uterus. So it's great for women that actually need to get pregnant in the future. Okay, so myomectomies are great for women that want to get pregnant in the future. There's some ladies who you can't really, not some ladies, you just can't do. You can't do a uterine artery embolization because you're going to change the blood flow to the uterus. Okay, if you want to be pregnant in the future. Same thing with radiofrequency ablation. You can't do those if you want to be pregnant in the future. So really the best ones for those ladies are things like myomectomies, especially if they're bothersome. The other thing that you can consider doing too is a hysterectomy. That's more definitive management. That's for my ladies who say, I never, ever, ever want to bleed ever again. So then definitive management, because certainly once the uterus was removed, the fibroids come out with it. So end of story. Okay? So again, I just want to give you a little briefer on what uterine fibroids are, talk to you briefly about what the treatments are, and then, we're here in case you have any further questions. You can visit our website to find out more at www.sugarlandmedspa.com. Thank you.